Take our lead, let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
Conclusions. Sleep bruxism was associated with vitamin D deficiency and low consumption of calcium and was also associated with increased scores of anxiety and depression. Further investigations should be performed to check if vitamin D and calcium supplementation could relieve sleep bruxism. 7 January 2021.
Take our lead.
The verdict: it depends on the source of your teeth grinding. If you're grinding during the day as a result of anxiety, CBD may be able to help calm you down. But if you're grinding at night, it may be the result of a more serious problem that requires further treatment. 22 June 2020.
Make your mark, take our lead.
Teeth grinding and jaw clenching, also called bruxism, is often related to stress or anxiety. It does not always cause symptoms, but some people get facial pain and headaches, and it can wear down your teeth over time. Most people who grind their teeth and clench their jaw are not aware they're doing it.
Let's help you make your mark.
Medication, muscle relaxers can help relax the jaw and stop nighttime grinding. If you take certain antidepressants that put you at risk for teeth grinding, a doctor might switch your prescription to one that doesn't. 6 January 2020.
Let's help you make your mark.
While there is no cure to completely stop teeth grinding, treatment can reduce its frequency decrease its impact, and relieve symptoms. In addition, home care tips can make it easier to cope with sleep bruxism. 21 August 2020.
Take our lead.
Lifestyle and home remedies. Reduce stress. Listening to music, taking a warm bath, or exercising can help you relax and may reduce your risk of developing bruxism. Avoid stimulating substances in the evening. Practice good sleep habits. Talk to your sleep partner. Schedule regular dental exams. The 10th of August 2017.
Make your mark, take our lead.
Doctors don't completely understand what causes bruxism, but it may be due to a combination of physical, psychological and genetic factors. Awake bruxism may be due to emotions such as anxiety, stress, anger, frustration or tension. Or it may be a coping strategy or a habit during deep concentration. 10 August 2017.
Take our lead.
There are several approaches to end daytime and nighttime tooth grinding, including: get a nighttime mouth guard, start exercising, relax right before bed, massage your jaw muscles, become more conscious of your clenching, stop chewing everything but food, avoid chewy foods. The 7th of October 2019.
Make your mark, take our lead.
Magnesium. Magnesium deficiency can lead to tense, spastic muscles. It also contributes to bone strength, nerve function, and cartilage health. In combination with calcium, these two supplements can work together to help relax your jaw muscles and relieve your TMJs of excess strain and tension. 2 October 2019.
Make your mark, take our lead.
If you notice that you clench or grind during the day, position the tip of your tongue between your teeth. This practice trains your jaw muscles to relax. Relax your jaw muscles at night by holding a warm washcloth against your cheek in front of your earlobe. 10 March 2019.
Thank you for watching. Please subscribe and hit the bell notification.